According to the Alzheimer's Association, Alzheimer's is a disease of the brain that causes problems with memory, thinking, and behavior. It is important to note that memory loss to this degree is never normal, and a doctor should be consulted as soon as it is determined. Also, the disease is very progressive. As we will see later, the disease moves in stages, which range from somewhat normal cognitive ability to needing help with the most basic of care, such as getting out of bed, brushing one's teeth, and getting dressed. Now that we know the what, let's learn the who. More than 5 million people in the world have the disease, with 11% of those people being within the age range of 65 and older, and a third of those being within the age range of 85 years and up. The Alzheimer's Association recently also published a list of 10 signs to look for in people suspected of having Alzheimer's. It is important to make a doctor's appointment as soon as possible if these symptoms are noticed in a loved one. The first symptom is memory loss that disrupts daily life, such as forgetting dates and basic information, such as what today might be, who the current president is, their own name, or seeing a familiar loved one. A second sign of Alzheimer's is challenges in problem solving, such as not being able to maintain records, such as balancing a checkbook or paying bills, being unable to follow tasks, or having trouble with math and numbers in a person who was once able to do even the simplest of calculations. It's important to note, however, that there are currently many apps out there that will help older people as well as younger people to keep their problem-solving skills longer in life. Some of those apps include popular ones such as Lumosity, which is a free app that allows users to see how their brain fares against other people their age in problem-solving skills and math skills. A third sign and symptom would be difficulty with daily home tasks, such as driving to a familiar place, such as a doctor's office, or even their own home. Another sign and symptom is a confusion of time and place, such as how a person got to a certain place, how long they have been there, and even such changes such as what season it may currently be. Yet another sign and symptom, which is often the first one to pop up second to memory loss, is trouble with vision and focusing, such as being able to judge distance that the person is from something, and determining color. As stated in some interviews, a person in late stages Alzheimer's can be able to walk into a room, look into the mirror, and not know that it is themselves that they are looking at. Instead, they might think that it is another person that they are looking at. The disease may also cause a person to become confused and lost easily, which is why there are a lot of news stories about people with late-stage Alzheimer's often wandering off. Although one fact that scientists have learned is that the changes that occur with this disease in the brain occur long before the first signs of memory loss take place. So it is important, as with any disease, to have early prevention and detection. Studies have shown that Alzheimer's disease appears to damage the left side of the brain more than the right. Composites of the brain have shown a 15% loss of volume in the left hemisphere of the brain. This is the area of the brain that plays a critical role in language and speaking skills, which is why one of the signs and symptoms is trouble speaking and trouble understanding. Another well-known fact of the disease is that it causes plaques in the brain. These are actually called tangles that are the misfolded forms of tau, which is a protein. As the disease progresses, the pathology of the tau spreads from one region to another. Scientists from Columbia University, New York City, and Harvard University have now shown that the abnormal tau spreads from one brain region to the other by moving across the synapses of the brain, which are the forms of the brain that send signals from one part to the other, which is how the disease is able to spread so rapidly. Now that we know some of the basics of the biology of the disease, let's look at the different stages that take part in this disease. The first stage would be the stage of no impairment. This is where the person is still considered to be functioning normal and they don't really experience any memory problems. And when they are interviewed with a medical professional where they're asked questions such as the date, who the president is, where they are, they're able to answer with little to no mistakes. Stage 2 is where there seems to be a very mild decline. This is where a lot of the symptoms seem to start showing themselves and where some people are able to notice a change in their loved one. The individual may start to feel and be conscious of the fact that they're having memory lapses, such as forgetting the location of everyday objects or familiar faces. But no symptoms seem to really be detected by the doctor at this point. Stage 3 is where there seems to be more of the memory loss and cognitive decline. This is where most of the time Alzheimer's is officially diagnosed and the doctor feels comfortable diagnosing it as Alzheimer's. There are noticeable problems with the person coming up with the right name, place, and any other thing that they might normally have recalled. They also have trouble remembering names when they're introduced to a person and then later that same day see the person again. They also may start having noticeably greater problems in performing social and work settings and tasks. They will also tend to forget material that they just read not even a few minutes ago, and they will start to misplace what they consider to be very valuable objects, which is where the emotions and getting easily upset also come into play. In stage 4, it's a moderate cognitive decline. This is where a careful medical interview is needed to determine how much loss a person has sustained. This is a stage where a person will have forgetfulness of recent events, impaired ability to perform challenging mental arithmetic errors, such as counting backwards from 100 or multiplying 7 times 2. They'll also have problem doing complex tasks, such as planning a dinner for people or even managing their own finances. They'll also be forgetful about their personal history, such as what they've experienced in their life, or when they got married, when they had children, all of the things that people tend to remember on a daily basis. This is also where they will experience constant mood changes and withdrawal from certain social tasks. In stage 5, this is where it progresses even more rapidly, where it becomes moderately severe cognitive decline. This is where there are great gaps in memory and thinking, as well as noticeable changes in the person. This is where they also begin to need help with their day-to-day activities. At this point in the game, they may be unable to recall their own address or phone number, or the high school that they once attended. The second to last stage is the severe cognitive decline. This is where the memory continues to worsen in the person and personality changes continue to change rapidly, and that individuals need significant help with daily activities such as using the toilet on their own, brushing their teeth, cleaning themselves, and even eating. They also, at this point in time, are at risk for wandering or becoming lost. The final stage of Alzheimer's is a very severe cognitive decline. This is where the individuals really lose the ability to respond to the environment, continue on a conversation, and eventually to control movement of their body. They may still try to form words or phrases, but their phrases that they form will not make sense to anyone, not even themselves. And at this point in time, they need a lot of help with doing daily care. And this is the point where most families have to either hire help to assist the person with their daily needs, or one person in the family has to have their full-time job be to care for this person. Also, as the disease continues to progress and take the life of the person, the muscles will begin to grow rigid and swallowing is impaired. While there is no cure for Alzheimer's, scientists have been able to study autopsies of past people who have had this disease, as well as to study mice in the laboratory. When studying mice in the laboratory, they gave some mice an antibody that is known to block interleukin. Interleukin is a molecule that causes inflammation. When the mice were given this drug, scientists were able to determine that there were decreased tau levels, which helped the mice not have so much plaque on the brain. Scientists are now currently studying this as a possible slowdown of the disease. While there are no cures for the disease, there are some medications to treat some of the symptoms. The first type of medications is an inhibitor, which prevents the breakdown of acetylcholine, which is a chemical messenger that's important for memory and learning. Some of the drugs that have been prescribed in this class are Aricept, which was approved in 1996 to treat mild to moderate Alzheimer's. In addition to that, there is also Exelon, which will in addition treat mild to moderate Alzheimer's. The second type of drugs that's currently been approved is known to regulate the activity of glutamate, which is a different messenger chemical that's also involved in information processing. The only drug that has been approved in this class is called Namenda, which is approved for moderate to severe stages of Alzheimer's. While there is no foolproof way to prevent Alzheimer's, scientists have come up with some ways for people to slow the effects of memory loss and Alzheimer's. For example, University of Kentucky researchers showed that exercise benefits glial cells, which are cells that support neurons in the brain. In addition, research has shown that multitasking impairs the working memory performance. The working memory performance of the brain is what allows the brain to use and store information on a daily basis. Finally, research has shown that people who maintain good heart health may reduce their risk of developing the disease. Why, you might ask? Because the heart is responsible for pumping blood through blood vessels in the brain. When a person has a healthy heart, this allows for more blood to be flowed to the body, thus also flowing to the brain.